Welcome to our video on the 5 early warning signs of ovarian cancer you should never ignore. Did you know that ovarian cancer is the 5th leading cause of cancer-related deaths among women? It often goes undetected until it has spread within the pelvis and abdomen, making early detection essential for effective treatment. While the signs can be subtle, being aware of them can make a significant difference in catching the disease early. Stay with us as we count down the 5 warning signs that should never be overlooked. Your health might depend on it. Before we start, please don't forget to click the subscribe button and hit the notification bell so you never miss an update from our channel. Now, let's begin our countdown and uncover these crucial early warning signs. At number 5 on our list are changes in menstruation. Variations in your menstrual cycle, such as unexpectedly heavier, lighter, or more irregular periods, can be a subtle early indicator of ovarian cancer. While it's common for menstrual cycles to vary due to a host of reasons including stress, hormonal fluctuations, or changes in diet and exercise, persistent alterations that don't seem to have a clear cause should be taken seriously. Ovarian cancer can affect hormone levels, leading to changes in the menstrual cycle. This might manifest as periods that are unusually heavy or prolonged, spotting between periods, or even sudden irregularities in women who previously had regular cycles. Any of these symptoms could be signs that the ovaries are not functioning normally. Because these changes can easily be mistaken for common menstrual disorders or changes typical of approaching menopause, they often go unchecked. However, if you notice that your menstrual cycle has changed significantly without any apparent reason, it's important to discuss these changes with your healthcare provider. They can conduct a thorough evaluation, including pelvic examinations, ultrasound, or blood tests to rule out ovarian cancer or other reproductive health issues. Recognizing and addressing these changes early can be critical in diagnosing ovarian cancer at a stage where it is more treatable and the outcomes can be more favorable. At number 4, we have gastrointestinal symptoms. Persistent bloating, indigestion, or a sudden decrease in appetite can also be warning signs of ovarian cancer. These symptoms are frequently dismissed as minor or common digestive issues, perhaps linked to diet or a temporary stomach upset. However, when these symptoms persist consistently for more than a few weeks, they should not be overlooked. Ovarian cancer can cause swelling or fluid buildup in the abdomen, leading to a feeling of fullness or bloating that doesn't go away with the usual remedies or dietary changes. Indigestion that becomes a regular discomfort and noticeable changes in appetite, especially a sudden lack of interest in food, can also be indicative of this condition. The presence of these symptoms might be due to the pressure and changes in the abdomen and digestive tract caused by the growth of a tumor. Because these signs can easily mimic less serious conditions like irritable bowel syndrome, gastritis, or temporary gastrointestinal disturbances, they often don't prompt immediate concern. However, their persistence is a red flag that warrants a closer look. If you're experiencing these symptoms and they don't seem to resolve with general care or lifestyle adjustments, it's crucial to consult with your healthcare provider. Moving to number 3, we encounter pain in the pelvis or lower back as another critical early warning sign of ovarian cancer. This type of discomfort is often more than just the usual aches or pains that might be dismissed as minor issues. Instead, the pain associated with ovarian cancer can be dull and constant, presenting a distinct sensation that differs markedly from typical menstrual cramps or the occasional back pain caused by physical strain or posture issues. Ovarian cancer can cause this pain as tumors grow and exert pressure on the pelvic area, including nearby organs and nerves. This pressure can result in persistent discomfort that doesn't resolve with over-the-counter pain relievers or rest, which are often effective for more common causes of pelvic or back pain. Additionally, as the disease progresses, fluid, known as ascites, can accumulate in the abdomen and further increase pressure in the pelvic region, exacerbating the pain. If you're experiencing ongoing pelvic or lower back pain without a clear cause, or notice that the pain is persistently present and different from what you felt before, it's important not to ignore these symptoms. At number 2, we have increased urinary urgency or frequency. If you suddenly find yourself needing to urinate more often or feeling an urgent need to go and there's no clear reason for it, like changes in fluid intake or new medications, this could be a sign of ovarian cancer. The reason behind this symptom is that a growing tumor can exert pressure on the bladder, mimicking the symptoms of a urinary tract infection or overactive bladder. This symptom is particularly tricky because it's commonly associated with less serious conditions, such as urinary tract infections, UTIs, which are quite frequent and typically easy to treat. However, if these symptoms persist and there is no improvement with standard treatments for more common issues, it's essential to dig deeper. Persistent urinary changes should prompt a conversation with your healthcare provider to rule out other potential causes, including ovarian cancer. Your doctor may perform a variety of tests to get to the bottom of your symptoms. This could include a pelvic exam to check for abnormalities, a urinalysis to rule out infection, and imaging tests like an ultrasound or CT scan to look for any signs of tumors or other issues in the pelvic area. At the top of our list, at number 1, is abdominal swelling or heaviness. This is one of the most significant and noticeable warning signs of ovarian cancer. If you observe an increase in abdominal size, persistent bloating, or a sensation of heaviness in your abdomen that doesn't go away, it's important to take this seriously. These symptoms occur when a tumor grows large enough to press on surrounding structures in the abdomen, or when fluid known as ascites accumulates, causing the belly to swell. The swelling can be quite pronounced, making clothes feel tighter or leading to a visibly distended belly. Unlike the temporary bloating that might come and go with dietary changes or menstrual cycles, this type of swelling is persistent and often progressive. The sensation of heaviness can also be quite distinct, making it feel as though there is a weight inside the abdomen that wasn't there before. This symptom is particularly alarming because it indicates that the cancer may have advanced to a stage where it is causing significant physical changes in the body. Early detection is crucial for effective treatment, so recognizing this symptom and seeking medical advice promptly is essential. Your healthcare provider may conduct a series of diagnostic tests, including physical examinations, imaging scans like an ultrasound or CT scan, and blood tests to detect markers associated with ovarian cancer. By paying attention to these changes and discussing them with your doctor, you can take a critical step towards early diagnosis and treatment, potentially improving outcomes significantly. Abdominal swelling or heaviness that persists should never be ignored, as it can be a vital clue in detecting ovarian cancer early. And there you have it, the 5 early warning signs of ovarian cancer you should never ignore. Studies show that early-stage ovarian cancer survival rates improve significantly with prompt treatment, yet only about 20% of cases are diagnosed at this stage. Being aware of these symptoms and seeking timely medical advice can make a substantial difference. If you found this information helpful, please give us a thumbs up and share this video with others who might benefit. Don't forget to subscribe to our channel for more health and wellness tips. If you have any questions or personal experiences with ovarian cancer symptoms, we'd love to hear from you in the comments below. Consider supporting our channel by sending us a super thanks or checking out our merch. Thanks for watching, and take care of your health.